In 2022, we co-produced and published a new approach to evolving people and communities, built on the foundations of 6 key principles. Be accountable to our people and communities. One size doesn't fit all. Start with people and communities. Trusted voices are key. Invest in people and communities. Nurture relationships across our ICS. In this video, we share our progress so far in achieving the principles. But first, let us start by hearing from Sam and Sarah on why it's important that we start with people as the experts by experience to deliver our clinical priorities.
Why is it important to go out into the community?
So then people get their voices heard across the different countries, and so if they don't get their voices heard, then they won't be able to communicate with other people in the staff in the community.
Okay, and is that important that everybody in the communities gets the voices heard?
Yes, so then it gets out there a lot better and so people understand other people.
Why do you think it's really important for people with lived experience to be a part of the things that we're doing?
Because then it showcases off what I've learned and what kind of lived experience I've got, so then they know a lot more about me instead of coming in and just going, well, what have you got? I can showcase off everything that I've learned and how far I've come till now.
Okay, so could I do that? Could I tell somebody about your life?
Because you haven't got lived experience.
Okay, so I could share your information, but I wouldn't be able to tell people how you feel or how things are going. And do you think our experience would be different because I've got learnt experience and you've got lived experience?
Yeah, a lot more, because you're learning, but I'm living it. I'm living it out in the big wide world.
It's crucial that we are accountable to people and communities, that we listen, act and feed back, and that we involve people from the beginning. In developing our joint forward plan, along with a public survey, we also reached out to groups that could help us seek the views of those underrepresented communities. The microgrants funded groups such as Aspiring Futures to hold conversations on our behalf. Let Manta tell you about her experience.
Because we're connecting to women at ground level, not at the NHS or in front of a secretary to the doctor, they're actually being able to have the confidence to come to us and say, you know what, this isn't working for me, or this is my problem and I don't know where to go from here. So we've been able to find out what can actually happen or what can we actually do to alleviate their pain. So it's quite a sort of an eye-opener in some instances that people are feeling this, and we wouldn't know that unless we did these sort of surveys to find out from ground level what is actually facing the women that we're engaging with. Women and people from the ethnic minorities and the community are being listened to.
We know that one size doesn't fit all, and that we have to work harder to recognise the reasons behind the issues that some communities face, ensuring that insight is sought and used to make changes. Investing in people and communities to build capacity, confidence, and help us find the solutions to the problems we face together. One example of our work in this area is the work with Wolverhampton University to understand the barriers for women from African Caribbean heritage to accessing cancer screening.
This project has 2 main aims really. Initially, we want to hear from the women across the Black Country in the voluntary community and social enterprise sector. We want to hear and listen to what their experiences are so far of accessing screening and breast screening services within the NHS. And then we want to capture that narrative and we want to bring it to health commissioners and health leaders in the Black Country. So I'm really excited about this project. I'm really hoping that it's a good community engagement project with really positive health outcomes, and I'm hoping that the women and the Black and Caribbean communities will have a design solution that they can own and take forward themselves.
I think the difference it makes when you invest in communities is that you can actually speak with the community to find out what their needs are, what their needs are and to create solutions. And another reason would be to boost confidence and give people a sense of purpose, especially due to the pandemic, when a lot of people have been isolated. And by working with them now, they're coming forward and they want to engage, they want to meet other people that are like-minded. So it's not even about gender, it's not about race, it's about everyone having the same goal. I think it links the bridge of trust, because there is some trust in issues to do with authority and the NHS, and having the committees on board at grassroots level, they know their clients and beneficiaries, and they can feed back and get more honest and open responses, and then we can be the bridge that links the community back to the NHS and vice versa, and then make changes that are relatable to people.
Trusted voices are key, and we are committed to continue working with the community and voluntary sector along with Healthwatch as key partners in this space. Hear from Sarah Taylor about our research work in this space.
With a successful REND submission last year, which stands for Research Engagement Development Network programme from NHS England, we now have the resources to create a community research-led programme that will not only train up voluntary sector organisations to conduct research and evidence their work themselves, but it really also complements the clinical data that we have. By doing so, mirroring up the two, we have an opportunity to really unlock what creates health solutions at community levels and what unlocks changes in behaviour that will help to alleviate the worst in our health inequalities.
We can't do this alone in the ICB. We recognise that for us to be successful, we must nurture the relationships across the ICS to further collaborate, share learning and knowledge, hold conversations once, and support each other to make the right connections. Over the last 6 months, we have developed people panel spaces in each of our 4 places with partners. Hear from Matt from One Wolverhampton about what it feels like to be part of these, and from Emma about how these spaces have been used to support our work on digital inequalities.
Taking a joint approach has enabled us to reduce duplication across the health and social care engagement landscape. We've been able to work more closely together and develop a community of practice around engagement. This includes working with partners across the city, and one of the advantages of this is it means that citizen insights can be heard by multiple organisations without the risk that people feel they're repeating themselves. As part of this, we've co-hosted 2 People's Panels. These are public-led spaces where the agenda is driven by the public and focuses on areas they wish to talk about. The space has proven really valuable for us, and we've been able to harvest the feedback and insights gained from these panels and have used this work to support our priorities as One Wolverhampton.
The ICB Involvement Team's People Panel really is about bringing communities together and helping to identify the Black Country's grassrooted community groups. They are really in the heart of everything that we do. So attending the People Panels allows us from a digital inequalities perspective to listen and hear about what people want in terms of digital transformation and digital solutions, and that's really important to us. The People Panels also enabled us to make more connections with diverse community groups, and we've been able to offer our Black Country Connected programme, whereby we're giving a GeoBook laptop connectivity, and we've got a support service to help people engage and access health and care services such as the NHS app. It's also helping them to upskill themselves and help them with wider determinants of health, such as applying for benefits, housing, unemployment, education. And without the People Panels in this forum, we might not have been able to reach as far and wide as we have done.
This is a journey that all ICBs are on, and we value the support from NHS England partners like Liv, who has a message for those working in this space.
We've been connecting with colleagues in the Black Country and really just observing the wonderful stuff that Stephen and his team have been doing to really connect and engage with local communities across the whole of the Black Country to listen and learn about what they think and what they need from our health services. It's been brilliant work, and my challenge to all of you, if you're listening to this and you're in a senior decision-making role, is what are you going to do with what has been heard, what has been said, the stories, the ideas, the gifts that your communities have given you, and how are you going to keep those communities involved so that you're constantly checking back and working with them about what comes next. because we'll only improve the NHS and make it really work for people who use services and for staff who work in services, if we involve them and build on what they know works and what they need.